Kita akan memasuki Industrial Symposia, namun sebelum itu izinkan saya menyampaikan beberapa informasi bahwa ada materi dari ACQALM kedua ini yang sudah dapat di-download, bisa dilihat di platform Anda. Dan kami menyarankan Anda tidak beranjak, tidak meninggalkan ACQALM ini sampai akhir nanti karena banyak door prize-nya. Ada HP Xiaomi Redmi Note 11, ada Xiaomi My Watch Lite, ada Seagate New Expansion Hard Disk External sebesar 1 terabyte. Jadi jangan meninggalkan ACQALM kedua ini sampai nanti selesai. Baiklah hadirin yang kami hormati, kita akan memasuki Industrial Symposia keempat. Industrial Symposia ini akan dibawakan oleh PT Abbott Alere Health. Kami persilahkan perwakilan dari PT Abbott Alere Health, waktu Anda 20 menit. Silakan.
Terima kasih Dr. Helen. Selamat pagi Dok. Terima kasih untuk kesempatan yang diberikan kepada kami Abbott Rapid Diagnostic untuk berpartisipasi dalam event ACQALM yang mengenai COVID Quality Management in Health Digital Transformation Era. Pada pagi yang indah ini, kami mengucapkan selamat kepada ACQALM dan panitia karena acaranya sukses dan pesertanya juga banyak. Ya. Pada pagi hari ini, untuk sesi simposium yang pertama, kami ingin sharing mengenai COVID, dan kali ini akan dibawakan oleh Dr. Mohan Ravuru, Director Medical Affairs dari Abbott Diagnostic. Jadi, presentasinya akan dibawakan oleh bahasa Inggris dan izinkan saya untuk membawakan dalam bahasa Inggris. Izinkan saya memperkenalkan diri terlebih dahulu. Nama saya Retista Bidi Hapsari, saya Product Manager untuk Virology dari Abbott Diagnostic. And now it's been 2 years since COVID-19 crept across the globe, and now at the latest wave of infection driven by the fast-spreading Omicron variant rapid subsides, many are beginning to question this coming COVID-19 becoming endemic. And now we are moving into an endemic setting. And actually, what does it mean when a virus like COVID-19 becomes endemic? And now this morning, we will present material about the transition of COVID-19 from pandemic to endemic and new variants of COVID, how vaccines work, and after we receive the vaccine, when should we still do the COVID test, and also factors influencing the post-pandemic transmission of SARS-CoV-19. And now today's material will be brought by Dr. Mohan, and let me read his short CD. Let me share the screen. Dr. Mohan Ravuru graduated from Karnataka University of Bachelor of Medicine in '92, and then he continued his master's degree from National University of Singapore, Masters of Science, and then he continued also his master's degree of Technology Management from the University of Queensland, and he graduated at 2005. Dr. Mohan Ravuru joined to Abbott as Director of Clinical and Medical Affairs Asia Pacific Region since 2020. Hi, Dr. Mohan.
Hello. Thank you very much for the kind.
Yeah. How are you?
I'm good. Thank you.
Thank you. We're glad to have you, and we thank you for your time to share your knowledge and experience about COVID. So the time is yours, Dr. Mohan.
Thank you. Thank you for the kind introduction. And can you see my screen?
Yeah.
Okay. If you look at what has happened over the last 3 geographical calendar years, this is a kind of schematic representation of what has happened so far. One is, of course, as soon as the outbreak happened, a lot of the industries went into containment and mitigation controls. They shut down schools, colleges, universities. People stayed at home. And as the infection spread, we were slowly trying to get everybody vaccinated and get back to work, but still there are secondary and tertiary waves of infection. And the new normal also dictates that there will be a couple of more variants as well, as we have seen in the past. And this makes the equation very important for us to watch out, that from a pandemic to an epidemic to an endemic, this transition really represents a typical naive viral infection of public health importance, where we have absolutely no immunity against the SARS coronavirus 2, which is why we are suffering through this pandemic, as we have seen. Also, if you just take a look at this picture, you have an infectious agent, which is the SARS-CoV-2. You have a reservoir, which is the animals, and it's supposed to be bats as well. And you have an intermediate host with a portal of exit. And you have a mode of transmission, which is predominantly respiratory droplets. And the portal of entry is the respiratory mucosa. And we are going to also infect susceptible hosts beyond us. And this is the reason why we need to pay attention. Just to let you know, last September, Nature produced some articles to show that common animals around us, including the household mice, are already infected with SARS coronavirus 2. Why is this important? It is important for us to recognize that the SARS coronavirus 2 is not unique to human beings. It can jump to animal reservoir and come back to us. And this is what happened with the H1N1 in 1918. That virus never went away. It went to birds and came back to us as bird flu. It went to pigs and came back as swine flu. It went to horses and other animals and came back as equine flu. So it keeps jumping back at us. And this is likely to be the phenomena with SARS coronavirus 2. But the good news is that it may not be as severe as infection that we saw with either the Delta virus or before.
Dr. Mohan,
yes.
Apologize. Your slide is still in the title. We're not moving from the titles. Or you want me to help to share your screen?
Yeah, please. Maybe you can project it. Do you have my presentation?
Yes, we have.
Yeah, you can. Yeah,
okay.
Please go ahead. I will stop sharing. Please go ahead. Yeah, we finished this. We are in the next slide. Next one. Yeah, you can make it full screen. I will speak to the slides. Thank you so much for the assistance. Yeah, very kind. So we have three things here. If you look at it, the infection seems to transmit in three formats: asymptomatic, symptomatic, and pre-symptomatic. And now with Omicron, we are seeing predominantly the asymptomatic infections dominate. And that's all the more reason why we need to continue testing, because without our own knowledge, we are acquiring the infection and we are transmitting the infection. And particularly children below 12 who are not vaccinated are the most vulnerable for the future variants, because they will easily acquire it, bring back, spread it to the elderly and the ones with comorbidities at home. And it will be the people who are at home who are likely to lose antibodies over time despite being vaccinated, and they become susceptible. So if you look at susceptible, infected, and infectious, these are the three natures of the patients who are likely to be infected. And what the disease really requires is just a fantastic susceptible host, a favorable environment where everybody is mingling with everybody in the name of festivals, in the name of returning to endemicity very quickly. The masking is dropped, hand washing is dropped, and we let our guard down, only to find out that the virus is likely to come back in a different format, because every time the virus gets transmitted, it has got another chance to change its genome, and that is what we call as variant. The mutations that are occurring at the genome level makes it evade our immune system and also deny the vaccine the power it is likely to exhibit. Next slide, please. So if you look at the SARS coronavirus 2 genome, you've got different proteins, and these proteins are nothing but antigens. You have the spike antigen, or it's also called as the spike protein. You have an envelope protein, you have membrane protein, and the nucleocapsid protein. And if you look at it, pay attention to the brown portion of the gene, because this is the gene that is mutating to the maximum and creating so many variants that it starts off as a variant of interest, it becomes a variant of concern over time as the infection spreads. And you can see here, alpha, beta, gamma. Yeah, that's fine. Please continue with the slide. Next slide, please. Yeah. So if you look at what has happened over time, variants of interest, if you monitor them carefully as they get transmitted, they become variants of concern. And when the variants of concern create maximum disease and transmission in the community, it becomes variants of high consequence. And when the morbidity and mortality increases due to variants, like for example, Delta variant, which killed a lot of people within a short period of time, patients could not even reach the hospital, oxygen shortages that we saw both in Indonesia, India, and many other countries, hospitalization, beds were not available. So the whole healthcare system can be overwhelmed very quickly. That would be the variant of high consequence. Next slide, please. So if you look at why are we concerned about the variants, it's because there are two things. It can cause higher viral loads in infected people. It can alter the transmission dynamics, and also it can suppress the host immune response. Even if you were to be infected and have antibodies in your body, within 180 days, they seem to be vulnerable for reinfection. And if you look at the recent Omicron variant, 30% of all Omicron variant infections were people who were already vaccinated. And between the 2-dose and the booster dose recipients, it was the booster dose recipients who had a milder form of the disease or less infections when compared to the 2 doses. And we do know that we are not living in a world where vaccination can be given to 100% of the population within a short time. These things take time. So it makes it all the more important that we continue to test the highly susceptible and the vulnerable for any traces of the transmission of the virus. Next slide, please. So here is a layout of all the viruses and the variants and the spike mutations that has occurred over time. And what is important for us to note is the number of mutations have increased over time. And most of these mutations seem to concentrate, particularly in the most recent variant, Omicron. Next slide, please. So we've already seen alpha, beta, gamma, delta, and Omicron. And it is highly likely that future variants will continue to occur in vulnerable communities because not every vaccine has been distributed to all the people. Some people may not be eligible for vaccination. Some people may lose antibodies over time, particularly those who are elderly and comorbidities. And also the vaccine efficacy reduces over time, and the variant may evade the immune system and the vaccine immune response. So all these are possibilities that exist. So till the entire planet is 100% vaccinated with more than 2 doses, it is highly likely that the small pockets and islands of infection will continue to occur throughout the planet. Next slide, please. So this is just a diagrammatic representation of the different mutations over time. And what is important is that the Omicron variant has got the maximum number of mutations, which also means it increases its transmissibility It may not be very highly serious or requiring hospitalization. Nevertheless, the transmissibility is important. High viral loads within a short duration is also a hallmark of Omicron, so also Delta. So all these are variants that are likely to occur in the future as well, but more on an endemic level. It may not happen at an international level. It may occur within small communities and vulnerable populations across many different countries. Next slide, please. What is important also is if you look at the Omicron and Delta, between the household contacts and non-household contacts, you can see here a 48% increased risk of passing on the virus when infected with Omicron when compared to Delta. That means if you have an Omicron infection and you never really detected it, you are highly likely to transmit to all the household contacts much more than if you had a Delta virus. So this is important for us to understand that we are not done. We are not done with the COVID-19 infections. It will reduce over time. The seriousness of the disease and the hospitalization will reduce over time. The fatality rate will reduce over time. But all these are possibilities that exist even as the world gets vaccinated and gets boosted. Next slide, please. So what is the stealth BA2 Omicron? BA2 is a subvariant of Omicron, sometimes referred to as stealth. Stealth, as you know, in English means quiet, without being noticed. So is now the most dominant strain of COVID-19 globally and the most transmissible variant of the virus, according to the WHO. It also not seen as very severe like other types of Omicron, but huge increase in case numbers. So I keep repeating this. It is not about the severity of the infection. It is the number of cases. And it is likely that an increase in hospitalizations in countries may occur over time, particularly when you have more number of elderly people and more people with comorbidities. Many countries, because they lifted the public health measures very quickly, it is likely that it is this that contributed to the spread of the BA2 Omicron. So this is the scientist's opinion. So I just want to reflect upon this opinion because every chance for the virus to transmit because we are letting our guard down will only increase the risk for vulnerable populations. Next slide, please. So if you look at what has happened over time, we started with Delta and then we have this Omicron variant, which is what we call as BA 1.1. And then we have 1.2 or BA2 variant, which is now becoming the dominant strain. And this is what I mentioned, variant of interest becoming a variant of concern. And this variant of concern continues to dominate in populations that are vulnerable. Next slide, please. So what have we learned about SARS coronavirus 2? Whatever the reason for the BA2 variant, whether it is because we let our guard down very early, scientists say that it was a reminder that the virus continues to cause harm. And there are three sets of people that we need to remember today. Those who are unvaccinated, those who are under-vaccinated, and those who are vulnerable. I repeat, unvaccinated, under-vaccinated, and vulnerable. All these three populations make it important that we continue to test, even if it is asymptomatic infections, we continue to need to test. As I showed you, the household contact spread is very quick with Omicron and 50% more than any other variant that we have seen till date. So that is a case in point. Next slide, please. So COVID vaccines, next slide. How do they work? Predominantly, the coronavirus infects through the spike protein, and the current vaccine targets the spike protein and creates an antibody against it, neutralizing antibody against it. And this is the very mechanism that the variants are targeting, as the variants can evade the immune system by mutating the spike protein. The antibodies may not be very specific to the virus itself. And that's the reason why we are always saying that vaccination is reducing the severity of infections, reducing the hospitalization, but It does not eradicate the disease. Eradication of the disease is not the goal of vaccination. It is to prevent you from falling very sick. So you need to remember this at this point in time. Next slide, please. So people with 2 shots versus people with 2 shots and a booster, you can see they had 25% more protection against Omicron when compared to just those people with 2 shots. So we also know that across the planet, there is different variation in the rate of vaccination of people. Some people may refuse vaccination. Some people may not be eligible for vaccination. Some people may be losing antibodies faster than the rest of us. So all these makes it important for us to continue to monitor and perform surveillance for variants of interest across different vulnerable communities. That's why I keep saying that despite vaccination, Omicron variant happened in 30% of people who were double vaccinated. So this is an important point to note. Next slide, please. The vaccine effectiveness against the BA2 subvariant versus the BA1 subvariant, you can see 2 weeks after the 3rd dose versus 25 weeks after the 2nd dose, it is 13% versus 70%. So it is important for you to know that if you had the 2nd dose and you were still waiting for the booster dose, you were vulnerable for the BA2 subvariant, and that we are seeing it across the US, Europe, South America, Africa, as well as Asia Pacific region, that people with 2 doses and waiting for the booster dose were the ones who are maximum vulnerable for the subvariant. Next slide, please. Testing and variants. Where are we with this? Next slide. So if you are vaccinated, and there are still scenarios where you could get potentially tested and use your results to make smart choices. What are these? If you have symptoms, obviously you have to test. If you have been traveling or if you need to travel, you need to test. And many countries have different regulations these days. If you have had a booster dose, you may not require a pre-departure test or a post-arrival test. Depends where you are in which part of geography you are. Test when you feel recovered from COVID-19. So test. So one study has found that half of people who were infected with Omicron still had very high viral loads by day 5, suggesting that they were likely to be still contagious. So these are epidemiological factors that we need to consider as important for being tested. Next slide, please. So what to do if you have been exposed? The first thing you need to do is test 5 days after the exposure. And what you do during those 5 days depends on your vaccination and infection history. If you are unvaccinated or vaccinated but not boosted, and you haven't had COVID-19 in the last 3 months, you should quarantine at home for those 5 days. And then wear a good quality mask around your household members so that you don't really are providing a risk factor or as a vector within your own household. As I showed you, household contacts are highly likely to be infected with Omicron, much more than Delta or any other variant. Next slide, please. So what is the way, what are the factors that decide on the endemicity? One is the community immunity. It's easy to remember, the community immunity. What percentage of people are carrying high level of neutralizing antibodies? We can only know over time. Right now, there is no correlate of protection. Let me explain to you what that correlate of protection means. When you give a vaccine, what quantity of antibody over what duration will provide infection? This fact is not known to anybody as of now, because we are still vaccinating, we're still getting exposed, we're still getting infections. We still don't have clarity on what is the duration and the durability of the immune response post-vaccination. And we also know that even despite being infected, within 180 days or 3 months, you are likely at risk in par with those who are unvaccinated as well, right? So what are the interventions available? So if you look at it, it's only vaccines. We don't have specific therapeutics targeted at COVID-19. And it is likely that it will take time for the drugs, very specific to SARS coronavirus 2 to appear in the market, because it's going to take time. Clinical trials on drugs will take time for them to be performed, because you need to establish the safety and efficacy and effectiveness over time, unlike vaccine. So the seasonality, so does it increase during winter seasons or crowded seasons in tropical communities? So that is also another factor that may contribute. And also the viral interactions. I'm sure you must have heard already that dengue and COVID-19 may coexist. Hepatitis and COVID-19 can coexist in the same person. And flu and COVID-19 can co-infect a single person during this endemic phase as well. So while we are vaccinated for COVID-19, flu vaccination is not that popular in Asia Pacific region. And last 3 seasons, we have not seen any flu. It doesn't mean that we are not going to get flu in the future. As the children get back to school, as people get crowded at the marketplace, we are likely to see the flu come back. And as you know, in Southeast Asia, flu is transmitted throughout the year. It is not seasonal. We don't have a winter in tropical climates and equatorial regions like Indonesia. So it is important for us to recognize these 4 things: immunity, intervention, seasonality, and viral interactions. Next slide, please.
Maaf, Ibu Retita.
Yes.
Waktunya 1 menit lagi.
Okay. Doc, we still have 1 minute.
Yeah, sure, definitely. So the vaccine effectiveness of the 3 depends on whether full vaccination with booster versus full vaccination without booster. The one with the booster seems to be, on all the 3 vaccines, better than the one without booster. Next slide, please. Next slide, please. Okay. So what is likely to happen in the future? Majority of the scientists seem to think that about 60 to 70% seem to think that it is likely to become endemic over time. And what is likely to happen? It might jump to animal reservoir and keep continuing transmission, but it may become mild and self-limited over time. Next slide, please. What would make the virus endemic? I've shown you the flow chart here. 1, what is the community level immunity? What are the therapeutic drugs available? What level of animal reservoir is infected with this virus? And does it come back? How sustained is the immune response by the vaccines? All these are deciding factors. Next slide, please. So the key driving factors is the immune escape, the reducing immunity over time, uneven vaccine distribution, people refusing the vaccine, and also animal reservoir, which is an important point. Next slide, please. So how do we protect ourselves for the future? The vulnerable and susceptible need to be tested, and the vaccination.
Maaf, Ibu Retista, waktunya sudah habis.
Thank you.
Okay.
Stop here.
So thank you, Dr. Mohan, for the interesting and comprehensive presentation. Terima kasih untuk perhatiannya, Dok. Waktu saya kembalikan ke Dr. Mohan.
Terima kasih PT Abbott Alere Health